Hello humans, welcome back to Your Thoughts Are Valid and I hope you all are doing great. So today we are going to continue with the unit 4 which is pain and its management, and this is part 15 of health psychology crash course. So let's see what all topic we are going to cover today. So today we are going to understand the role of psychology in pain treatment and CBT, cognitive behavioral therapy. So let's start with the video. So first let's understand what is pain management. So, pain management is an area of modern medicine which utilizes the multidisciplinary team to help ease the pain and suffering of patients living with long term pain to improve their quality of life. Medicine is usually the first port of call to manage pain. However, when pain is not responsive to medication or resistant to treatment or persists after healing has occurred and an exact cause of the pain has not been found, the alternative treatment or a combined approach can be used. The alternative to medicine or combined approaches to pain management are broad and each of which can be based upon different paradigms of understanding pain. Different approaches come from the wide range of healthcare professionals, unique treatments towards pain management, not only limited to mental health or psychiatrists, but can include physiotherapists, occupational therapists, nurse practitioners, medics, news specialists, and massage therapists. So basically, this is kind of new, this area in health psychology, and it is about modern medicine. It is used to ease the pain and suffering of patients who are suffering from chronic pain so that they can live their life productively, they can improve the quality of their life. And usually, medicine is used to cure the pain, but if medicine is not working for some reason, then alternative treatment, or we can say combined approach, like psychology and as well as medicines, okay, like therapy plus medicines, can be used. So this area is broad and it is not just limited to psychologists or psychiatrists. It can include physiotherapists, occupational therapists, nurse practitioners, etc. Moving on, psychological approach to pain management, as well as the neural interactions and links the brain goes through when a person is in pain. There are multiple layers of complex abstract thoughts and feelings a person goes through, which culminates how much pain a person feels and how they deal with pain. Okay, so as we know that when we are in pain, so some kind of physiological changes are happening in our body. Some kind of physiological disformity is there. Like it can be internal, it can be external. So usually it is linked to neural interactions and brain. So just like that, there are multiple layers of complex abstract thoughts and feelings that a person goes through when he or she is in pain, which actually tells, which actually determines how much pain a person feels and how they deal with pain. Their cognitive constructs, behavioral constructs, and environmental influences are all intertwined in a complex web of individuality which need to be considered and incorporated into any treatment for them to be effective and are found out during an initial assessment. Okay, so while we are using the combined approach of medicine and like psychological approach to pain management or just psychological approach, it is like it is suggested that we need to find out cognitive construct, behavioral construct, and environmental influences of an individual, like how he is perceiving the pain, how he or she is dealing with the pain, that will come under cognitive construct. Then behavioral, like what he or she is doing to uh, cope with the pain, or what at that very moment when the pain is severe, what the person does and how the people around react to it. Are they supporting him or her, or are they not supporting him or her? All these things are need to be determined, uh, like while assessing the situation. It is these personal, individual, and holistic areas which make it a psychological approach sitting within the biopsychosocial model of patient treatment. The psychological approach recognizes that pain is not solely a physical sensation but also involves psychological and social factors. So, as we learned biopsychosocial model, we understood that when we use this approach of model to deal with a particular illness or even pain, so we usually analyze biological determinants, then psychological, and as well as social. So basically, this approach says that pain is not just physical, but it also involves psychological and social factors. And by considering a person's cognitive and behavioral constructs as well as their environmental influences, healthcare professionals can gain a comprehensive understanding of the individual's pain experience. So, this is just for the healthcare professionals to understand what the person is going through emotionally, physically. Then this holistic approach is crucial in developing effective treatment plans within the biopsychosocial model as it takes into account the unique needs and circumstances of each patient. Moving on. Pain serves an important purpose by alerting you to injuries such as a sprained ankle or burned hand. Chronic pain, however, is often more complex. People often think of pain as a purely physical sensation. However, pain has biological, psychological, and emotional factors. Furthermore, chronic pain can cause feelings such as anger, hopelessness, sadness, and anxiety. To treat pain effectively, you must address the physical, emotional, and psychological aspects. Medical treatments, including medication, surgery, rehabilitation, and physical therapy, may be helpful for treating chronic pain. Psychological treatments are also an important part of pain management. Understanding and managing the thoughts, emotions, and behaviors that accompany the discomfort can help you cope more effectively with your pain and can actually reduce the intensity of your pain. Psychologists are experts in helping people cope with the thoughts, feelings, and behaviors that accompany chronic pain. They may work with individuals and families through an independent private practice or as part of a healthcare team in a clinical setting. Psychologists may collaborate with other healthcare professionals to address both the physical and emotional aspects of the patient's pain. When working with a psychologist, you can expect to discuss your physical and emotional health. The psychologist will ask about the pain you experience, where and when it occurs, and what factors may affect it. In addition, he or she will likely ask you to discuss any worries or stresses, including those related to your pain. Then moving on, for patients dealing with chronic pain, treatment plans are designed for that particular patient. The plan often involves teaching relaxation techniques, changing old beliefs about pain, building new coping skills, and addressing any anxiety or depression that may accompany your pain. One way to do this is by helping you learn to challenge any unhelpful thoughts you have about pain. A psychologist can help you develop new ways to think about problems and to find solutions. In some cases, distracting yourself from pain is helpful. In other cases, a psychologist can help you develop new ways to think about your pain. Studies have found that some psychotherapy can be as effective as surgery for relieving chronic pain because psychological treatments for pain can alter how your brain processes pain sensations. A psychologist can also help you make lifestyle changes that will allow you to continue participating in work and recreational activities. And because pain often contributes to insomnia, a psychologist may also help you learn new ways to sleep better. Moving on, stress and chronic pain. Having a painful condition is stressful. Unfortunately, stress can contribute to a range of health problems, including high blood pressure, heart disease, obesity, diabetes, depression, and anxiety. In addition, stress can trigger muscle tension or muscle spasms that may increase pain. Managing your emotions can directly affect the intensity of your pain. Psychologists can help you learn relaxation techniques such as meditation or breathing exercises to keep stress levels under control. Some psychologists and other healthcare providers use an approach called biofeedback, which teaches you how to control certain bodily functions. In biofeedback, sensors attached to your skin measure your stress response by tracking processes like heart rate, blood pressure, and even brain waves. As you learn strategies to relax your muscles and your mind, you can watch on a computer screen as your body's stress response decreases. In this way, you can determine which relaxation strategies are most effective and practice using them to control your body's response to tension. Moving on to cognitive behavioral therapy. Cognitive behavioral therapy is a compound term for the selective combination and integration of treatments aimed at reducing or extinguishing the influence of the factors that maintain patients' maladaptive behaviors, beliefs, and pattern of thought. Pain management programs vary in content and duration as they are often tailored to local population and specific client groups. They are also commonly constrained by practical and financial contingencies and the currently poor availability of suitably trained and competent staff. Cognitive behavioral therapy is a method that can help manage problems by changing the way patients both think and behave. CBT assumes that changing maladaptive thinking leads to change in behavior. Therapists have helped individuals challenge their patterns and beliefs and replace errors in thinking such as overgeneralizing, magnifying negatives, minimizing positives, and catastrophizing with more realistic and effective thoughts, decreasing emotional distress and self-defeating behavior. By challenging an individual's way of thinking and the way he or she reacts to certain habits or behaviors in a constructive manner, can create cognitive dissonance and therefore an opportunity to alter someone's thinking patterns and behavior. So here we need to understand the terms we used. So actually we used quite a few terms like overgeneralizing, magnifying negatives, minimizing positives. So these all are cognitive distortions. Cognitive distortions are irrational patterns of thinking. So basically, therapists help individuals to determine their cognitive uh, distortions, basically their irrational patterns of predicting a situation or analyzing a situation, and they replace these errors in thinking. Okay, what are the examples of cognitive distortions can be overgeneralizing. So it means something happened to you and now you feel like it is always gonna happen. So you just generalized it like that. Like you experienced pain at 7 p.m. For like 2 days, and now you like at 6:30 p.m. you are anxious that at 7 p.m. it's going to happen. So it's like you just generalized it. So now there can be placebo effect. So you are overgeneralizing the situation. It might not happen again. It might be due to something uh, like you might have eaten something which is like gastric in nature. So you might be experiencing gastric pain, and on the third day you might not eat something which is gastric in nature. So it might not happen. So the overgeneralizing is not fine. It might going to make you feel anxious, and you will experience difficulty with your thoughts, and basically you won't be able to cope with that until and unless you will determine that you are overgeneralizing the situation. Then magnifying negatives. So in magnifying negatives, you are just focusing on the negative aspects. You are just ignoring the positive effects, or maybe you are just seeing the negative aspect and just exaggerating it. So it is like exaggerating the importance of shortcomings and problems while minimizing the importance of desirable qualities. So it involves magnifying your negative qualities while minimizing your positive ones. Okay. Then there can be minimizing positives, which is opposite to magnifying negatives. So I hope it is clear till here. The cognitive distortions also, although this is something which is usually taught in CBT, but we are studying here for CBT for pain management. That's why I'm not, like dealing with this in detail. But when I am just going to focus on CBT, like as a therapeutic process, then I will tell you about these cognitive distortions in details with lots of examples. And yeah, catastrophizing is also there. So it's like basically viewing a situation as considerably worse than it actually is. So these all are some of the cognitive distortions. So a therapist replaces these cognitive distortions with more realistic and effective thoughts, decreasing emotional distress and self-defeating behavior. So let's move on. How does cognitive behavioral therapy for pain management work? So CBT for chronic pain focuses on making cognitive and behavioral changes to disrupt the problematic cycle of thoughts, feelings, and behaviors responsible for pain. While it may not get rid of the pain entirely, changing some of these thoughts or behaviors can help to decrease the pain over time. Then behavior change. Some CBT techniques focus on changing behavior. This may look like scheduling pleasant activities or exercise. By making changes to behavior, there is a resulting change to thoughts and feelings. For example, engaging in an enjoyable activity will lead to positive feelings and thoughts. Then cognitive change focuses on education and identifying and challenging unhelpful thought patterns. Perhaps the person experiencing chronic pain has thoughts about never feeling good again. A CBT therapist may point out that this type of thinking fits an all or nothing thinking pattern and then teaches the client how this type of thinking impacts their feeling and behaviors. The therapist may then engage the client in reframing their thoughts, resulting in changes to thinking and consequently changes in behavior and feelings. So all or nothing thinking is basically like it's either true or it's either false. It's either right or it's either wrong. It's either severe or it's just not there. So there is nothing in between when people think this way. So that's not the case. And this is also a type of cognitive distortions, which a therapist will make you understand that you are thinking irrationally. Then address the complex presentation of pain. Pain usually presents with many other problems that complicate treatment, such as depression, anxiety, and borderline personality disorder. CBT is effective in treating all of these potential underlying mental health diagnoses in addition to its effectiveness with treating chronic pain. Moving on, underlying processes that structures the therapy. Seven key factors addressed. First is direct positive reinforcement of pain behavior. All overt behaviors communicate pain to others, including tone and content of a speech, gait and posture, facial expression, and the use of medical aids. Often the consequences of pain behaviors are detrimental for the patient and add to suffering. A CBT environment would be sensitive to the situations in which patients are directly reinforced for pain behaviors and would seek to minimize their effects. Then second is indirect positive reinforcement of pain behavior. Avoiding behavior is the most common form of reinforcement of pain and disability. Patients will continue to avoid pain eliciting situations, believing this avoidance to be analgesic when in fact it promotes further pain. Patients develop a contingent pattern of activity, doing more when one feels good and less when one is in more pain. Over time, this leads to a steady decline in overall activity. Then third is positive reinforcement of well behavior. Lack of reinforcement of health behaviors extinguishes or diminishes the behavior. In a CBT environment, the staff should be trained to recognize and reinforce well or healthy behavior They should also be trained to encourage patients and family members to be self-assessing and self-reinforcing of well behavior. Moving on. Physical fitness and function. Chronic pain patients typically lose any sense of normal sensation and normal physical stress and strain. Therefore, the unfit and sedentary patient will experience many symptoms of physical disuse that can be regarded as pain-related and potentially harmful. Increasing general fitness is thought to reduce fatigue and reduce the number of fatigue-related somatic symptoms that can be judged to be pain-related. Personal achievement in fitness and function are common goals for patients and can often provide a first point of positive reinforcement and self-reinforcement. Then fifth one is cognitive retraining. Patients are encouraged to develop insight into the automatic nature of self-defeating and self-denigrating patterns of thinking. Patients are then encouraged to test the reality of these patterns of thinking and develop ways of challenging the premises from which these thoughts arise. This principle of developing a controlled meta perspective in which one can understand the effects of thoughts upon feelings and feelings upon thoughts underpins a number of the typical contents of therapy, including communication skills, improved problem identification and problem solving, anger management, stress reduction, and development of a self relaxation response. Then education and empowerment, often a first stage in treatment, is to provide a credible rationale for treatment. Education alone is not an effective treatment for chronic pain. However, an understanding of the self-management approach is essential. Key areas that are commonly addressed are the causes and consequences of pain, managing doctor-patient communications, anatomy and biomechanics, the rules of social interaction, and sleep hygiene. Moving on, critical process factors. In addition to these six therapeutic principles that underpin the content of specific sessions in a typical program of CBT, there are also a number of factors that determine the process or successful delivery of the therapy. Any therapy must be clearly directed, and all staff should operate under a consistent set of principles. The more experienced the staff, the better the therapy will be. Similarly, the staff have been trained for this specific treatment rather than having general training. Therapy will be more effective. Regular structured supervision for all team members should be compulsory because the difficulties and distress of patients are often transferred to team members. Conflicting models of treatment should be avoided. For example, changing an analgesic regime in the middle of a CBT program would undermine the development of self-reinforcing well behavior. In all cases, CBT should be understood as the beginning of a lifestyle change, and inappropriate maintenance of change component should be included. Moving on, CBT techniques for chronic pain. So, mindfulness is one of those. When someone experiences chronic pain, they tend to worry about the future or dwell on unpleasant past experiences. Mindfulness approach to chronic pain is about shifting focus to the present moment and noticing thoughts, feelings, and sensations without judgment. Then acceptance and commitment therapy for chronic pain. ACT, acceptance and commitment therapy, is driven by the concept of psychological flexibility. It differs from CBT for chronic pain in that it focuses on changing relationship with thoughts, feelings, and behaviors associated with pain rather than on changing thoughts, feelings, and behaviors themselves. The therapist will help the client explore, identify, and connect with their values and goals rather than being consumed by their experience of pain. Then there is a relaxation training. There are many types of relaxation techniques that can be explored, such as progressive muscle relaxation, deep breathing, and guided imagery. Chronic pain results in chronic stress on the body, so practicing relaxation regularly can mitigate the impact of chronic pain on the body. Then moving on, there is cognitive restructuring. Chronic pain can lead to or worsen unhelpful thinking patterns. Cognitive restructuring aims to identify these problematic thoughts and situations when they arise. Then the therapist and client will work to challenge or reframe the thoughts in order to change the impact they have on feelings and behavior. Then there is activities scheduling. Those who experience chronic pain may become isolated and inactive due to fear of worsened pain. Activity rescheduling is a way to increase clients' engagement in rewarding activities by identifying and scheduling pleasant activities. For an added benefit, therapists may encourage clients to schedule time with positive social supports. Increased activities beneficial for both physical and mental health. Then pacing. This technique involves identifying activities that the client tends to overdo, resulting in worsened pain. The client will be asked to think about how long they can do the activity before they experience pain. Then the therapist will assist the client in setting a schedule that includes amount of time that the activity can be tolerated before pain is likely to be experienced, followed by a period of rest. For example, 10 minutes of mowing the lawn, followed by 5 minutes of rest, and repeat as necessary. Then let's understand some examples of CBT for pain management. So migraine is one of that. CBT for managing headaches or migraines will likely involve stress reduction or stress management techniques. These techniques may take the form of cognitive and behavioral work, such as identifying situations that cause the highest level of stress and the thoughts related to the situation. From there, the therapist can engage the client in cognitive restructuring or challenging the unhelpful thoughts. Alternatively, or in addition to cognitive work, behavioral strategies such as teaching and practicing relaxation methods may be employed. CBT for chronic pain usually requires about 10 sessions with variability based on the client's presentation and progress. Then second is arthritis. Pacing is commonly used to address arthritis pain as this technique helps clients learn how to manage their activities, taking into consideration their ongoing pain. Therapists may combine pacing with other techniques such as cognitive restructuring in order to address underlying unhelpful beliefs clients have about their pain. As with most CBT for chronic pain, treatment will likely take about 8 to 10 sessions. And then there is back pain. Mindfulness based CBT is a technique that may be used for treating chronic back pain. There are many exercises, but the general concept of mindfulness is shifting clients' focus to present moment. The therapist will guide the client in noticing and observing different sensations without judgment. Mindfulness for chronic pain usually takes about 8 sessions. So that is it for today's video. Thank you so much for watching, and I will see you all in the next video.